Walk with me. Ibuhlungu inhliziyo, ibuhlungu inhliziyo, inhliziyo yami ibuhlungu inhliziyo. Ibuhlungu inhliziyo, inhliziyo yami ibuhlungu inhliziyo. I can't just sit here and die. Unemployed. UCT MBCHB, class of 2017, struggling to live, struggling to find work, accepting any offers, send help, ready to serve. My name is Dr. Zolelwa Sifumba, and 12 years ago, as a medical student, I contracted multidrug-resistant tuberculosis from the hospital. Walk with me.
Dr. Sifumba.
Hi, Raj.
Thank you. So you've tell us about the poem. Tell us about the song you just sung.
The song that I just sang says, Ibuhlungu inhliziyo, and it translates into my heart is in pain. And it is sang in a language called Xhosa, but I mean, it has similar words to Zulu, so it's a Nguni language, so there's similarities, but it's Ibuhlungu inhliziyo. And yeah, it's,
my heart
is in pain.
Where is that coming from?
Where is that? Well, there are multiple pains that my heart is in right now, the biggest of which is the fact that I am unemployed, and not just me, many other health workers where I come from are protesting right now. They are doing sit-ins because our government has decided that they're not going to employ us. And I don't understand how, when there are clinics where they don't have doctors, while we're in the streets.
You've taken the pain you've lived through with MDR, multidrug-resistant tuberculosis, having, I think you told me that you didn't know when you had contracted the disease when you were about in your early 20s, 21 years old, if I remember correctly, as a medical student. You had not been told that medical professionals were 6 times more likely than the general public to contract that disease. How did that feel when you started to talk about that particular point?
So I was upset first because I didn't understand why we weren't warned, why we weren't told that our lives are also at risk. When we were taught about TB, we were taught about a woman, low socioeconomic status, lives in a 1-bedroom house, and you're just like, okay, that's not me, you know? And then I got it, and it turns out all I had to do was breathe. And so I needed to tell people, and that need to tell people was because I needed to express myself. You see, I grew up not really allowed to express myself. And so after facing that pain, after sitting with myself and realizing that I am in pain, and I haven't been taught what to do with it. I learned from my parents that I need to ignore it, but I can't sit here and die. And so I started speaking, I started expressing myself, and I started empowering other medical students first that, yes, it is important that the systems look after us. It is very important, but it is also very important that we nurse our own pain. Even though they didn't teach us how to do that, it is very important that we do that. And not just health workers, I think everyone sitting here tonight felt pain or they witnessed pain and they thought, I'm doing something about this. And I love that, but please don't forget that voice inside that is asking you to take time off, that is asking you to go to the toilet, that is asking you to care for yourself, because if you don't, there's this disconnection from yourself, and from there, you cannot connect with anyone.
You've turned your pain into purpose. A lot of us working with communities around the world witness pain frequently. What gave you the courage to turn pain into purpose?
Thank you for the question. It wasn't an immediate courage. I first hid it because I thought, what are people gonna think? What's wrong with me? Like, why, you know? And then I had to sit with my pain. I had to cry. I had to see that I was in pain, and from that pain, I realized that I had a choice to make. I could listen to the message that was inside the pain, that actually it's time to do something about this. And I also had this great sense that I don't want anybody else to have to go through this. I was on 21 different pills and an injection. I was in pain all day. I had to leave school. I lost friends. So much was happening, and it was so hard to just tell people how I was doing, but I realized that I needed to. And so while I almost died, or rather, I almost killed myself because of it, it saved my life. Because I had to get it out. And what was amazing was, as I started getting it out, people started sending love to me. People started sending support to me. People, they weren't all there. I reached out to the global community, in fact. And people were sending me love, and people were sending me support and asking me how I was and what I needed. And I started asking myself, what do you need? What can I do for me? And I started supporting myself, and people started supporting me, and that was the beginning of my journey towards healing. But I needed, and even as I'm here with you all, I need to tell you all about my pain so that we can all start to talk about our pain. Stop ignoring it, stop suppressing it, stop pushing it down. We need to face it, we need to feel it. And I've got a poem, and at the end of the poem it says, like those who build trees whose shade they will not benefit from, our grandchildren will not be afraid of pain. They will not fight it, they will not flee away from it, because I had to face it. I had to be honest with myself. Honesty. I had to be honest with myself that, look, I'm not okay in John, I'm sinking, and if I don't do anything about this, I will die. So please, everyone here, look after yourselves. Take time off. I'm reminded of the picture on airplanes. I'm sorry.
No, please.
You know, the one where they say, put on your own oxygen mask before you. Imagine we were all here putting on oxygen masks on everyone. Eventually, we all pass out. So please, let's look at our pain, because there's pain that brought us here today.
I remember the first time I heard you speak. Yeah. Thank you for. Thank you for being so open with us. The
difficult.
first time I heard you speak, we were in Lyon, France. Peter Sands had just become the head of the Global Fund a year earlier. It was 2019 in October, and President Macron had hosted the Global Fund replenishment then.
It was actually my birthday that day.
Was it?
Yeah.
Well, you made a mark on all of us because you told your story, and I encourage everybody to watch that speech. You helped that day the world raise over $14 billion. You have clearly have what I think a lot of individuals here hold deep in their soul and their heart, not just the mind of an innovator or the hands of a builder, but the soul and the heart of an activist. And yet, I'll be the first to confess, it's sometimes difficult to lean into that. One needs courage. You have so much courage. Where do you get it from?
I can't say I've always had this courage. And I've always had, a few people trying to encourage me and tell me, you're powerful, you're this, you're that. And I was just like, look, I don't see that. But I had to be courageous. I saw that I was dying. I saw that I was dying, and I realized my medical school wasn't going to do anything about it. I realized the health system wasn't going to do anything about it. I went to collect medication. When I was injected, I was told that you're not going to cry here. And so I was just like, I want to live. And yes, I gave up on TB treatment every night. Like every single night, I was like, I'm done. It's fine. I'll die. And then an hour later, I'm like, I don't want to get XDR. I don't. And not a lot of people have that insight that if you don't take the pills, but I understand why people stop. We call them defaulters, but please stop using that word, because I wanted to stop every single day. And I'm a doctor. I understand exactly what's going to happen. And if the pills I'm taking are stopping me from catering to my family's needs, I'm going to stop taking the pills. Because fine, I may survive in a couple of years' time or whatever, but what about my kids who need food tomorrow?
Yeah.
And so I had to encourage myself that, look, babe, get up. Like, yes, it's painful. Get up. Yes, you fell again. Get up. Go tell people. And the more I told people, the more my community increased, my network. And on nights where I couldn't encourage myself, those people would encourage me.
I want to ask you one last question.
Yes.
Get up is a great call to action for all of us in the communities we work with. It's also perhaps a phrase in your mind when you're playing basketball. Yeah. And she's got a pretty killer jump shot, actually. We decided we're going to play one-on-one the next time we get a ball in front of us. Why do you play basketball?
I don't play anymore, but I used to play, and I'd love to go back to that. I play basketball. First of all, it's fun. I love how cool it looks, like the moves. Like, I want to be a baller. Who doesn't want to be a baller? But I very much enjoy the teamwork. I mean, you could have 5 people on the court that are all trying to get the ball and drive it down and shoot, but it's like, That's going to look weird, everyone. But it's amazing that you're going there, you're bouncing, and you see your teammate, and you see that he's perfectly aligned to the hoop, and nobody else sees him. So you shoot it to him or her, and they put it in there, and it's like, yeah, you know, like I saw that, you know? And so it just reminds me that we have to do it together. Like, it's not, and I think it's true of anything. We must do it together.
Get up and do it together.
Yeah.
Join me in thanking Dr. Sifumba, please.